Hi everyone, welcome to my channel Capsa. In the previous video tutorial, I have discussed about what is the pathophysiology or cause, what kind of risk factors are available, and in this video tutorial, I will discuss about signs and symptoms, diagnosis and treatment. Alzheimer disease is a progressive disorder and this disease develops over age time like mid 60s or a person's 30s. So there is a late onset variety symptoms and early onset variety symptoms are considered. Mild symptoms are considered under early onset variety. And second one is moderate and third one is severe. Severe is considered in the late onset variety symptoms. In mild stage, a person may seem healthy but has more trouble in making sense of the world around them, and problems include like memory loss, poor judgment, taking longer time to complete daily tasks, trouble in handling money and paying bills, forgetting of recently learned information, mood and personality changes, this kind of. In the second stage or moderate stage, more intensive supervision and care become so much necessary. And the symptoms include increased confusion and memory loss, withdrawal from social activity, inability to learn new things, difficulty in organizing thoughts and thinking logically, changes in sleeping pattern, more difficulty in daily tasks like wearing dresses, bathing, etc. Last one is hallucination, delusion and paranoia. Now you need to understand what is a hallucination, what is delusion and what is paranoia. So hallucination is a feeling things that are not really there or not really exist. A person with AD or Alzheimer disease may see like children are playing in the garden when no children actually exist. This kind of things are hallucination. Second one is delusions. Delusions is false belief. Third one is paranoia. Paranoia is just unrealistic thoughts. Like when a person believes others are trying to harm them. This kind of. And paranoia is a unique symptoms which is also seen in the patients suffering from schizophrenia. Clear? In the third stage or severe stage, people cannot communicate and are completely dependent on others for their care. Near the end of their life, the person may be in bed mostly or all the time. And the symptoms include inability to communicate, no awareness of recent experience or the surroundings, seizures, groaning, moaning or grunting, increased sleeping. Groaning is a brief low pitch sound, but moaning is prolonged low pitch sound. Grunting is different from groaning and moaning. Grunting is simply deep pitch sound but shorter period of time. Means short deep pitch sound. Okay. Now what are the diagnoses? So based on this kind of clinical findings, diagnosis can be categorized into three types. First one is medical history, second one is mental status evaluation, third one is specific tests which are available or for the brain, related to brain. So medical history means if there is any family history of AD, okay, to check it is inherited or not. Second one is mental status evaluation. In this type of diagnosis procedure, here the specialist will check the person's mental abilities such as memory, problem solving, counting, etc. Now third one is specific test which are related to brain, means CT scan, full form is computed tomography scan, or MRI. Third one is PET or positron emission tomography, CT scan, or MRI or PET. This kind of tests are performed. Now the treatment. So for treatment, medicine is the first choice, then physical exercises. For medicine, first choice of medicine is cholinesterase inhibitor to increase the concentration of acetylcholine, okay, or prevent the breakdown of acetylcholine. Cholinesterase inhibitors are donepezil, rivastigmine, galantamine. This kind of medicines are used. Second one is glutamate regulators. It means this kind of medicine regulates the activity of glutamate. Okay, so this medicine is memantine. As a glutamate regulators, memantine is used. Third one is orexin receptor antagonist. Now it is unknown to you. What is orexin? Orexin is a kind of neurotransmitter in the brain that helps people to keep awake. It means this neurotransmitter regulates the sleep cycle. And which part of the brain orexin actually present? Orexin actually found in the hypothalamus. Okay, and there is two type of receptors are available, orexin 1 and orexin 2. These two type of receptors. So orexin receptor antagonist bind with this kind of receptors and helps the people in the changing in the sleep cycle. Okay, last one is atypical antipsychotics. You know what is atypical antipsychotics? Like brexpiprazole. So this medicine specifically use brexpiprazole. And as a orexin receptor antagonist, suvorexant. This kind of medicine are used. Okay. Last one is physical exercises. So this is the end of my lecture. If you like the video, please do like, comment, share and subscribe. Thank you.